Because I may have to leave a little early.
Right. Okay. Thank you very much. Welcome everyone. Good afternoon, good morning. We are from several time zones. So welcome to today's webinar, which is a webinar that is organized by BIGD, BRAC James P. Grant School of Public Health, and in partnership with GAGE, which is the Gender and Adolescence Global Evidence. It's a international research network and a research program on gender and adolescence. So my name is Dr. Imran Mateen. I'm the Executive Director of BRAC Institute of Governance and Development. I'll moderate today's session. So to begin with, I think, I just want to set today's scene. Today's webinar is on young people's voices during COVID-19. And it's really going to delve into how the pandemic has affected adolescents in urban slums and low-income settlements in Dhaka, but also outside Bangladesh as well. We actually have a colleague from Ethiopia who is also going to be speaking about very similar methods that has been used in the context of Ethiopia as well. So this is going to be a global conversation on a population group on whom I think the effects have been pretty severe, yet have been more or less ignored. So I think it's really important that we are paying attention to this population segment to really understand how the pandemic has affected them and their lives and their aspirations. So today we're going to be focusing on that. It's a global conversation. So we have one of the main papers is going to be on the research that BIGD and James P. Grant School of Public Health, we collaborated on to look at these issues in the context of Bangladesh. But we'll also listen to a colleague from Ethiopia in the GAGE consortia, and she'll be talking about the Ethiopian experience. Working Yadete, she'll be talking about that. And then this is also going to be a multi-method conversation. The research that we are going to be presenting today, and also the research in Ethiopia, is using qualitative research methods. However, we also have Dr. Jennifer Seeger, Assistant Professor, George Washington University, who, along with IPA in Bangladesh, they have been looking at very similar issues with a quantitative method lens. So we're also going to have a method conversation. So we're going to have a method conversation, and we're going to have a global conversation on a topic that is of great importance. And finally, we're going to have a conversation between policymakers and practitioners here. So we have got researchers who are going to be presenting. We have got policymakers we have here Honorable Deputy Secretary, Mr. S.M. Latif, who is also the project director for accelerating protection for children. So he will basically be shedding light from a more policy point of view. And then we have our chief guest today, Ms. Rashida K. Chaudhary, who obviously, has been a executive director, honorary executive director of CAMPE and former advisor to the caretaker government. She will be bringing in obviously the policy, but more the practitioner perspective in terms of these issues. So it's going to be a really enriching conversation, global, multi-method, and between policies and practitioners on a very important topic. So without further ado, I think I'll request Mahin Sultan, Senior Fellow of Practice and Head of Gender and Social Transformation Cluster of BIGD, and Farhana Alam, Assistant Director, Center of Excellence for Gender, Sexual and Reproductive Health and Rights at the BRAC James P. Grant School of Public Health to make the presentation. You have roughly 25 minutes, and I will warn you, and I'll try and keep the time. Thank you. Over to you, Mahinapa.
Thank you. Farhana will begin.
Okay.
Thank you, Imran Bhai. Thank you, Mahinapa. Hello, everyone. I'm Farhana. I work at James P. Grant School of Public Health, BRAC University. So before I start the presentation, I just want to say one small thing that, both BIGD and JPG, we do a lot of rapid impact research. And I think this COVID-19 impact on adolescents under GAGE project is yet another addition to that list of research. So can you see the slide? Sorry.
Yes, we
First-
can.
first
Yeah, we
slide.
can.
Yeah. So
thank you.
before I start, I just want to, since though me and Mahinapa and I are presenting today, but we have a whole research team who's working on, it's the same GAGE research team who's working on this project. So I want to mention their names first. Rupai, aage slide ta Jan. Just mention the names. So we have in this research, Professor Sabina Faiz Rashid, she is the principal investigator. Mahin Sultan, she's the co-principal investigator. We have Sylvia from GAGE, who's been involved and supporting us throughout the process. We have Professor A.K.M. Masarul Islam. Then we have Taslima Akhtar, Mehdi Hassan Onik, Saklain Al Mamun from BIGD, and Samir Ahmed Raha, Shojib Rana, Alvira Farhin Ria, and Prantik Roy from BRAC JPG School of Public Health, who has been working on this project. So this is the structure of the presentation, the one we're presenting today. So we'll start with the objective of the research and talk a little bit about the methodology, and then we'll present the findings thematically. I'm just briefly want to mention that we have collected data for this research in 2 rounds. So initially we looked at the adolescent knowledge about COVID-19, what is the impact on education since schools are closed, and then what are their coping strategies and resilience in terms of economic hardship, psychosocial well-being during and after lockdown. And based on the round 1 evidence, what we realized, and we decided to focus on a few themes more in depth, and then we added the inter-household relation and violence and adolescent perception of the community and government in the second round as the focus of our data collection. And we will conclude the presentation with some policy implication based on the evidence. Next slide, Ajay. So just to present a brief context about the COVID-19 situation in Bangladesh right now. Bangladesh is the 26th position globally with 469,423 cases till December 3rd, 2020, with 6,748 deaths, where the overall infection rate was 16.72% of the total tests. So the state sanctions lockdown started on March 26th, and it ended on May 31st. All the educational institutions were closed till then, where HSC and equivalent exams got postponed at the beginning and then canceled by the Ministry of Education. When we're talking about the education of adolescents, study has shown that the total study time declined from 10 hours to 2 hours during the pandemic due to the closure of the school and other educational institutes. In terms of getting external support, a PPRC BIGD survey shows that most did not get external support. Those who did, support was far from income loss, and the per capita food expenditure decreased by 21% in rural areas and 27% in urban areas if we compare it how it was in February and how it was in April after the pandemic and the lockdown. And house rent and utilities were considered as an urban burden according to the survey. Next slide, Robin. So the main objective of the research, as Imran Bhai said also, that the main focus of GAGE on adolescents, because of one of the main reasons was adolescents go through this physical, emotional, and cognitive transitions. And of course, many studies has shown that adolescents from the low-income settlements of Dhaka city, they are particularly vulnerable during this pandemic. Because of both the socioeconomic background and the physical, emotional, and cognitive transition they go through in this age. So the main objective of the research was we decided to do a rapid qualitative research study to understand how this pandemic and the countrywide lockdown impacted the lived realities of the adolescent boys and girls who live in urban slums and low-income settlements in Dhaka, and sharing these emerging findings in real time, as I already mentioned, that we have done in many other projects so far. This was a qualitative study, as I've mentioned before, and the data collection was, we did 2 rounds of data collection. The first round was in April 22 till 2020 till June 2020. It was at the beginning of the pandemic. And the round 2 was October 2020 to November 2020, which was after the lockdown was lifted. Sorry, I can't see the slides. Can you see? Yes, I think I can see it now. So we have done as data collection method of due to the pandemic, we couldn't do in-person interviews. So we did phone interviews conducted with mobile phone, and we also provided phone research to the respondents. We did purposive sampling with basic criteria such as age, sex, marital status, physically challenged condition as in disabilities, and working status and school dropout. And the study site was 2 peri-urban slums and 1 low-income settlement located in Dhaka. The sample size was the same, drawn from the same research population as it was in the previous GAGE baseline project back in which was conducted in 2018 and 19. So the age group back then was 10 to 12 years old and 15 to 17 years old, and which was later when we revisited them. Now the age group was, of course, after 2 years, 12 to 14 years old and 17 to 19 years old. And the sample size, we interviewed 30 adolescents and 3 key informant interviews in round 1 and 26 adolescents and 4 key informant interviews in round 2. The ratio for the boys, girls in the sample was 1:2, as in we, for every 1 male respondent, we took 2 female respondents. Next slide. So this is the demographic information of the respondent. It's looks a bit complicated, but I can just tell you briefly. In school, for round 1 out of 30 interviews, we had 21 in-school interviews and 9 out-of-school interviews. And round 2, it was 20 out of 26 interviews, 21 was in-school interviews and 5 out-of-school interviews. So one thing you can see that we have missed, like we couldn't interview 4 respondents in round 2. And just to give a reason that out of these 4 respondents that are missing in round 2, 3 of them were married and we couldn't reach them due to some restriction from their in-laws. And the 4th one was a working adolescent who couldn't manage time due to the work responsibilities. And among the key informant interviews for round 1, we have interviewed 1 government official and 2 key informant from the education sector. And from round 2, it was 1 government official and 3 person working in NGOs, relevant NGOs. Next slide. So the first, I'm going to the findings right now. So we'll start with the knowledge about COVID-19. Of the adolescents in low-income settlements in Dhaka. So the first, for this theme, we wanted to see what they know about the COVID-19, about the precautions and preventive measures. Although all the adolescents interviewed were aware of the term coronavirus, their knowledge and perception about different related things were varied by their age and information source. For example, the younger cohort respondents were aware of the term coronavirus and what are the disease symptoms and preventive measures, but they lacked detailed information as in how does it spread, how to stop the spreading, this kind of detailed information. On the other hand, older adolescents were able to provide more information on that. At the same time, some adolescents also discussed the stigma and fear that prevails in the community regarding COVID-19, There's a quote which says, a female, 17-year-old female respondent said, the people in our area are panicking. If someone has a slight fever, no one goes near them, everyone stays in fear. It shows that how the whole coronavirus, the fear of getting COVID-19 was there in the community. And there's another instance where community people, adolescents mentioned that even someone has some fever or anything, they don't mention it to others because they're scared that police will come and take them for the isolation. So this kind of fear was mentioned by the adolescents in the community. In terms of access to safety measures, it was mentioned that family members of the adolescents, they follow necessary safety measures such as washing hands, wearing masks, and social distancing. And it was also shared that soap and masks were easily available, though many of them mentioned that they use reusable masks as that's a cheaper option than the one-time masks. Some adolescents mentioned that people in their area do not abide by social distancing rules. You can see in one of the quotes where a male, 17-year-old male respondent said that we live in block 5, which is small bazaar or market. That's why it is crowded all the time. And the risk of getting infected is very high here, but many people are careless. Already 7 people have been infected, but no one seems to take serious steps. So there are concerns regarding not abiding by the social distancing rules among the adolescents. Next slide. Okay, so when we ask them what are the sources of information, these are the common sources that they mentioned. One of them were television, and then of course the community people, school teacher, parents, they got to know about the information from them. And then there's Facebook and YouTube. Was mentioned as another source, and announcement through loudspeakers by the local authorities was also mentioned as one of the source of information. You can see this quote by a female, 14-year-old female responded, which says, I just saw that they are canvassing on a rickshaw. Some people also circulated posters and leaflets to create awareness, giving out soap and telling people to wash their hands. So at the same time, when they mentioned what their source of information were, it was also seen that, when they're getting information from Facebook and YouTube, there are lots of misleading information as well, which they were confused about. There's one quote mentioned by one 17-year female respondent who said, I heard that Allah also forgave all the Christian, Hindu, and Buddhist people in China because they have started offering namaz or prayer in the mosque. So this is also both like positive and negative sides of social media, that they can have information, but at the same time can have information that's misleading and not monitored properly. Next slide. Yeah, so next theme is we wanted to look at how the whole COVID-19, the pandemic situation had an effect on the education of the adolescents. And we looked at during lockdown and after lockdown impacts from our 2 rounds of data. So it was seen that studying at home by themselves was challenging than studying at school, mainly because they didn't have the support from teachers and no longer have the access of the guidance, instruction, notes, etc. A few respondents, they mentioned that they got help from their mother, siblings, or they bought guidebooks and digital contents. You can say there are quotes which also mention that they cannot talk to the teachers directly, which they could ask for a teacher for help. So that was mentioned by many of the adolescents. And then another quote that says, we have a guidebook which I'm following for my studies. I have difficulty studying at home with math, science, and English. But another thing, what most respondents also mentioned, that they don't have a fixed study routine because of the lockdown or the schools are closed. So they have a lot of free time coupled with a lack of routine and homework, which they say they are becoming distracted compared to the pre-pandemic school days. They mentioned being less engaged with their studies now. A 17-year-old male respondent said that it is hard for me to concentrate on my studies at home I spend my time on the mobile talking to friends or watching TV. Another respondent said, I didn't follow a routine as it is my study. I just read whatever I think need to read. So yeah, there was lack of routine was mentioned as one of the causes that the study was getting hampered. And after lockdown, since the end of the academic year and after government's decision of not taking annual exams, the decision was made that the evaluation would be made based on the assignments that was given from respective classes. Adolescent mentioned studying at home was, they're reported to studying less than before when the exam was canceled. And few of the respondents also shared their concern regarding the HSC pass on basis of the SSC results, government decision, referring to this as auto pass. You can see in the quote, a 19-year-old female, she said, now there is an auto pass everywhere. There is no value in auto pass. Again, I have to study for varsity admission, which is university admission. I don't have guidance for that either. I'm tense about that. Even in the job field, whom will they give the job to? Those who have an auto pass or those who passed by working hard? So clearly there was like concerns about the future as well, going to the university or getting a job, which was related to this decision of HSC exam. Some of the adolescents who were like, comes from better off families, they mentioned that they started taking tuitions from home tutors after the lockdown was lifted. Next slide. So since the schools are closed, all the educational activities are online, happening online. So the modalities used in the distance learning, as mentioned, was mainly the online video classes on Facebook, Zoom, authorized by their educational institutions. There are online TV classes. They got help from teachers by personal phone call and social media communication, and internet video contents suggested by their teachers, school teachers. Next one. So all the adolescents, they mentioned many challenges they face where during this study from home situation, even on the online learning. Adolescents from low-income families, they say they don't have educated family members who can help their study. As you can see in the quote, a 17-year-old female, she said, you need an educated elder brother or sister to study at home, or either one of your parents has to be educated. Among us, there is nobody who is educated. So clearly they don't have anyone to help with their study or guide them to their study when they're studying at home. Many of them.
Farhana, we have maximum 10 more minutes. I understand Mahinapa would need 15 minutes, so I would really request you to wrap up.
This is the last slide, Imran Bhai.
Yeah,
this is the last one. Yeah, I'll
you.
finish in like 1 or 2 minutes. So online classes, they mentioned that online classes are not interactive enough. Compared to traditional classes, they cannot ask questions immediately or get any answer. Teachers were not experienced on how to conduct the online classes. So that was also hampering the teaching quality. And the access to online was a huge issue due to, first of all, the financial constraint. They couldn't buy internet, lack of information on where to go, which platform to use, weak internet connection for those who could buy internet. And also in a family, there's one mobile phone, like 2-3 siblings, so shared devices. So it was like they couldn't attend, all of them cannot attend all the classes at the same time. And lack of space and privacy for studying was also mentioned as an issue. TV classes only available was up to SSC level, which is 10th grade. So after that, no TV classes were available. And in terms of gender differences, girls were like more likely help their family parents, their mothers in the household chores. At the same time, boys mentioned to have greater access to mobile devices and internet to get help with their studies. So this is, next slide. Yeah,
Okay,
so this
I'll
is
take over.
Mahinapa will
Okay, Thank you. So we'd like to talk about adolescent coping strategies and resilience, particularly with regard to their economic situation and psychosocial well-being. And here we had data from the 2 rounds. What is not surprising is that, you know, the adolescents realized that their family economic condition was getting worse. Their parents were losing their jobs. We had working adolescents who were also losing their jobs. They were uncertain about the future, where their money would come from, where, you know, their shops, when they'd be able to open. Interestingly, the married female adolescents were even more aware of the family finances than the unmarried ones. But, you know, there was this tension of how they would get their jobs back and where they would borrow money from. So this was very apparent. Next slide, please. And so to cope with the economic hardship, the children were aware that their family members were taking loans to survive. And because of taking loans, they were also in debt. And then we also found that a coping strategy was to reduce their daily consumption of food. So instead of, you know, the different, the nutrition went down, the different items they would take went down, the number of meals went down, and they were even cutting back on necessities. And these findings are very much consistent with larger scale survey findings that BIGD has done with PPRC and also JPG, which has found this kind of impact on income and nutrition and indebtedness. Next, please. So when we went back for the second round, hoping to see maybe a little improvement in the economic situation, we found that, in fact, the economic hardships were continuing. Although some of the shops had opened, some of the businesses had opened, but things were very slow. And because of the burden of the loans that the parents and even some of the adolescents had taken, this was putting an added pressure. The working adolescents, 4 out of 5 of them had gone back to work, but work was also less than it had been before, let's say an electrician's job or whatever. People were not demanding as much services. So to cope, they were still cutting down on their expenses, eating less than before. One of the interesting things we found, we had thought that people would want to migrate back to the villages. We found a few cases who did, but we found that migrating back to the villages was also expensive, which not everybody could afford. Some of the adolescents were thinking, and even the adults, of taking on more work and jobs so that they could help repay the family loans or contribute to the family income. But there were fewer jobs available in this overall economic context. And some girls, older girls, mentioned that their parents weren't very happy about them going back to work because they didn't feel that this kind of economic context was secure enough. So they were not allowed to contribute, let's say, to the family income. Next, please. So this economic hardship, next slide, please, was also had a very big impact on their
Sorry, Mahinapa, we can't hear you.
for the children was how long this would continue, what would happen to their exams, what would happen to their future, because they saw education very much as a way of ensuring their future. Another very important thing was the social isolation that the lockdown created. This is specifically during the first period of the lockdown, where they got cut off from their friends, they got cut off from school, they didn't have people to spend time with, and this had a very big impact on them, feeling very isolated and cut off. And for those who had a lack of digital connectivity, let's say not having access to phones or not having money for internet connections, this was even worse. Those who could keep in touch with their friends and others through mobile phones or the internet felt better, but those who were completely cut off felt much worse. And, this is something that kept coming up. And as Farhana has mentioned, we found gender differences in internet and digital connectivity, with boys having better access than girls. Older children having more access to devices, more of their own devices than younger siblings. And overall, a constraint was internet connectivity and being able to pay for the internet. Next, please. Another source of tension was the fear of COVID, because with all the information they had received, which we showed at the beginning, they were afraid of falling sick and also of other family members feeling sick. And they talked about the kind of impact this kind of fear had on them. And this meant that some of them even turned to religion. They mentioned that they had been praying more than they had prayed before, because they thought this might be a protection against the disease and against falling sick. They realized that going to the mosque was also a source of, infection, but there was also the fear that if they didn't pray, that God would punish them by their falling sick. So they were caught in a sort of double bind. So these were some of the pressures that they were going through. And if we go next, please. If we talk about coping, so among the coping strategies they adopted was talking to their parents. But interestingly, we found that it's mainly the girls who were sharing their worries with their parents, whereas the boys tended more to rely on their friends and peers for support. So, there was this difference, but the family and friends were a source of support. Married adolescents, however, mentioned that they were talking to their husbands, but they were missing their natal families in the time of crisis. So that was also interesting, because they didn't feel they got the same amount of support from their husbands as they would from their parents or their siblings. Next, please. After the lockdown, the psychosocial well-being seemed to improve, especially for those who were less worried about exams. But those who wanted and were preparing for exams, as Farhana had mentioned, this idea of autopass created a lot of conflict and unhappiness, because they would have liked to take the exams and establish their, let's say, educational credentials. But because of this, they weren't sure what value their certificates would have or whether they'd be able to find jobs. But we also found that a number of them were adapting to the new normal and saying that we don't feel as bad as we used to before, and we can go out more. Next, please. So part of this coping with going with this new normal was being able to go out more. Here also there were differences, with the boys being allowed to go out much more than the girls were. Using of mobile phones, watching TV was seen as a big source of support for the adolescents, that, they were even saying that they had become addicted to it, but this gave them a lot of contacts with friends and recreation. But overall, we saw that there was a lack of, any kind of recreational facilities or services to cope with their stress or psychosocial needs. With girls being even not able to go out and talk to their friends as easily as boys could. Next, please. Okay, another area where we explored, as Farhan has mentioned, more in the second round, because we saw that there were things coming up in the first round that needed greater exploration. One was the issue of intra-household relations and violence. Next, please. We saw that domestic work allocation, and then this came out in the first round as well, but we didn't realize that it was a source of conflict as well within the household, that female adolescents, it was just assumed that they would help with the household chores, and they were spending a lot of time doing this, which was affecting their education. But we also found that male adolescents were participating in household work, but they were much more, shall I say, it felt like an obligation, and they resented it much more than the girls. And there was also a gender difference in the type of housework being done by male and female adolescents. Married female adolescents, they had a heavy workload before as well as later during the COVID, so it didn't make any change. But we found the difference in how the boys and girls perceived the domestic burden, with the girls just taking it as for granted, whereas the boys were resisting. Next, please. We had picked up that in the first round, which is why we explored more in the second round, that there were increases in tension and arguments within the household. And this seemed to be, according to the adolescents, linked to the economic scarcity and having to take loans, having to lose work. So there was this overall uncertainty in the family, which was affecting the adolescents and creating a very negative atmosphere. The adolescents talked about short-tempered behavior, irritable behavior, increase in domestic violence with the mothers, and also in some cases against the children themselves, who were both physically and verbally abused. Not that this was very common, but this did occur in a number of families. Next, please. Another area where we wanted to explore, because this is often seen as a risk area when there is any kind of disaster, that with families losing income, becoming more insecure financially and otherwise, that they might want to marry off their daughters before 18. And the adolescents we spoke to were very conscious that this is a risk, that this might be happening. But the younger adolescents were more idealistic, saying that no, girls should study and this shouldn't happen if this is against their will. But their older adolescents were saying that no, there is a need to preserve the honor of the girls. There is insecurity. Getting married might not be a bad option if they are better off getting married than being a burden on their own families. So this is, we feel, an area that needs to be looked into and followed up, because there is a risk that girls will be forced into early marriage. Next, please. Another area we explored was adolescents' perceptions of the community and the government interventions. Next, please. Especially community relationships, we found, we explored in the second round, because we found that this is an important area of support and also conflict for the family. Because of the corona situation, there is a deterioration in community relationships, with people staying to themselves, more fighting and quarreling. In the first round, we also found a fear of police violence and other kinds of violence. The stigma of corona, that those who have been infected might be spreading this. So keeping away from them, identifying them, and people not wanting to be suspected of having corona. But on the positive side, the adolescents also reported that there was a greater solidarity for people who had suffered financially during the crisis. Next, please. In terms of government responses, the adolescents were also quite aware of what the government had done and not done. And we're quite positive in terms of, let's say, the lockdown, in terms of providing assistance, aid, food aid, or money, though they did speak of corruption, both in government and non-government bodies, mismanagement. And one thing they were very critical of was this auto-promotion, that, as I mentioned above, that it sort of devalues the education. But when we went for the second round, there was no kind of assistance going to these communities. And overall, there was no initiative specifically for adolescent well-being. Next, please. So finally, I'm sorry we've taken a little longer than we should have.
Wrap up.
Yes, I'm just wrapping up. So conclusions, next slide, please. Next slide. We've seen that adolescents are a very good source of information for their families, that the uncertainty regarding education is a major source of worry. We've found that, the importance of social relationships for their well-being, And this includes communities, schools, and the family. We can't neglect any of them. We've seen that there are disadvantages within the communities in access to internet and mobile devices between boys and girls, between different income groups. We've seen there are differences in how COVID has affected boys and girls' education, burdens, mobility. I've spoken of socioeconomic differences, and there are age differences with older adolescents having more voice and autonomy. So finally, next slide. What are the priorities for young people in this context that we think that practitioners, policymakers, and other researchers should look into? And others have been working on the issue of wanting a recovery plan to address the educational gaps which are coming in, especially for low-income community adolescents. The digital connectivity we want to emphasize is very important for information, education, as well as entertainment. And we need to take into account the gender differences in this. We need to raise awareness of the impact on adolescent mental health. Also, the health, education, etc. With that, we also need to think about recreation and involvement of the adolescents, even as volunteers. There is this great scope and they would like to be involved in community activities. And finally, we think that we need to all keep in mind future risks and challenges which are arising from the present situation, especially in terms of increased school dropouts and early marriage. Even if it hasn't happened yet, there is a risk it might happen. And this might also lead to increased incidences of child labor. So these are things we all need to keep into account. Thank you.
Great, thank you. Thank you very much, Mahinapa and Farhana, for that very detailed presentation. Very exciting findings with a lot of insights. And I think I'm particularly struck by the heterogeneity of this experience. And I hope that we will be able to delve into some of those heterogeneities as we continue the conversation. So at this stage, I would like to invite our GAGE Ethiopia Qualitative Research Lead and Research Uptake and Impact Coordinator. I hope I get the name pronunciation right, Wakene Yadete, to really speak about the Ethiopian experience. You have about 10 minutes, so please try and stick to that. We're already over 15 minutes, so let's all try and pitch in our part to try and get back to time. Thank you.
Okay, thank you very much for getting this chance to share with you some key findings from the Ethiopian research on COVID-19. As already mentioned, Ethiopia is one of the GAGE research country. And for the COVID purpose, so far we conducted 3 rounds of virtual data collection. The third one has been just finished, so we haven't started the analysis. So what I am talking now is focusing on the round 1 and the round 2 data collection findings. So when we go to the key findings, particularly related to awareness raising, it seems that's more or less similar to the findings from Bangladesh. Actually, we conducted the research both in urban and the rural areas, and the findings show that adolescents in urban areas had a better awareness, better awareness as compared with their counter rural ones. In rural areas, adolescents didn't have access to social media in most cases, no television at all, but some had access to radio programs, but in urban areas, They had access to television, radio, social medias, particularly Facebook, Telegram, email. So they had really a better access, but we observed even in urban areas a big gender divide where boys had better awareness as compared with girls, because girls were mainly busy with domestic work, and they had also limitations in accessing digital technologies, particularly social media. When we come to education, our findings show that overall there was a limited online access, both in rural and urban areas, except in private schools, which are actually dominantly found in big urban areas, where the private schools provided online learning through the Telegram platform. But even in big urban areas, including the capital, Addis Ababa, the government schools were not managed to provide any kinds of online learning, even though the Ministry of Education tried to provide remote learning through television and the radio, but because of sometimes interruptions of electricity, that was not had a bigger impact. So overall, students who were in government schools and almost all of them in the rural areas had no remote learning during the COVID period. And that was really the biggest challenge that students facing. Even for the private school students, there was a lack of guidance and mentoring from teachers, because since the education was through social media, Telegram, there was no actual physical contact, so that teachers couldn't support students. And the support from the parents was also limited, particularly since many of the parents were not educated. They couldn't know how to provide proper support for their kids at home, which is somewhat similar to the findings from Bangladesh. Adolescents with disabilities were more affected as compared with adolescents without disabilities, because of their disability type. They didn't had even any access to education. For example, adolescents with hearing disabilities couldn't even listen to radio and the television, so they missed everything. So that was really shocking and disturbing. Regarding the continuation of the education system, around June, July, the Ministry of Education decided auto-passing for students in primary and secondary, except those in grade 8 and grade 12, who were entitled to take regional and national examination. So that automatic promotion was perceived positively by the parents, but the students didn't feel comfortable with that decision, because without having any learning, I think that was devastating. And recently, I think it was in around the mid-November, the government decided to reopen schools step by step. So now almost in every regions of Ethiopia, primary schools were reopened. Universities are in the process of reopening. I think that is a good progress, of course, by taking a number of COVID-related measures in order to prevent the spread of the virus. On the psychosocial aspect, it's more or less similar with Bangladesh. there was a feel of isolation among the kids because of isolation from their peers, from their teachers. In most cases, particularly in urban areas, students are forced to stay at home the whole day, the whole week. So that was had really a huge stress on the students, and there was a fear of contracting with the virus, and this was particularly a serious issue during the first few months after the outbreak, but gradually people started to think that the virus is not as such a big problem. It is not a dangerous illness. So now we see that even many students, parents stop even using face masks, no social distancing at all, except in schools now. And I don't know, we don't know actually why the number of daily cases has been declining, even though people stop social distancing and also using face masks. So this means that now the fear of contracting with the virus is declining. So that psychological problem is now almost lifted.
If you could just finish in a minute or so, please. Thank you.
Yes. So in relation to the economic issue, there was a loss of household and adolescent livelihood situations. The price of food items increased. That will lead to food shortage in many of the poorer households, which had an impact on young people, limited access to emergency social protection schemes. That is also a big problem. In relation to health, there was a huge shortage of hygiene materials, shortage of water for hand washing in many poorer communities, both in urban and rural areas, and also sometimes the resistance by the communities, as I said, to health guidance. Yeah, I think these are some of the key areas that I talked. So if you have questions, I can further discuss. Thank you very much.
Thank you very much, Wakine. I think we already are seeing common threads and new insights. I think the insight that you had around not only the fact that adolescents with disabilities fared worse, but also I think this real interesting insight that a lot of the intervention design around digital technologies, radio-based instructions, and television-based instructions were not designed to be friendly towards persons with disabilities. And I think this is a very important insight, and we may get back to that in the discussion. And now I'd like to invite Dr. Jennifer Seeger, Assistant Professor, George Washington University. I actually have a few. I mean, you obviously are going to say what you're going to say, but I actually had a few, kind of questions for you, especially with respect to, because, you basically did the quantitative survey on this very similar theme. Really like to understand if you could shed deeper lights, kind of more broader light. I mean, I guess qualitative shines more deeper light, more broader perspective on this heterogeneity. And I think I identified four, if you could perhaps try and see whether you can. So one is gender. Clearly that's one very important one. Age also emerges as an important one. There is, within this age group, we see a lot of variation in the experiences. Marital status seems to be another big one. Married adolescents had very different experience than unmarried adolescents, and the way where they experience this. And finally, I think whether you're a student or not, whether you are in school or not. So it'd be great if you could, kind of perhaps reflect on some of these heterogeneities with the quant data that you have been involved in. Jennifer, over to you.
Thank you so much. Well, I definitely, so I'm going to go ahead and share my screen. I put together some slides. I think you'll find I touch a bit on the age and gender heterogeneity. And I do have, I don't have prepared information on sort of the marriage and student heterogeneity, although we do have statistics prepared in that arena. So maybe as we're going through the question and answer session, I can maybe pull out some more heterogeneity and see what's interesting on that piece. I just want to make sure, I'm going to switch to slideshow view. And I just want to make sure everybody can see my slides all right.
We can.
Okay, great. Yeah, so what I've done is I went through the very interesting and detailed presentation that we just saw from Farhana and Maheen, and tried to pull out some of the quantitative statistics that I thought complemented or shed some additional light on the information that they shared. And I think you'll see that across many dimensions, what we see in the quant data, you know, sort of reflects what was discussed in the qual. So before I get into some these statistics, I just want to talk a little bit about the sample that we have for this COVID data. So the data that I'm going to be presenting is from 643 adolescents from Dhaka, and they're from, you know, the same locations as the qualitative sample and built around the same adolescents as the qualitative sample. At the time of the COVID surveys, our adolescents were about 15.7 years or about 16 years old on average. And it's our sample is also pretty close to 50-50 male and female. And this round of COVID data was collected in May and June 2020. So just after sort of the major lockdown or, you know, partially during the lockdown that went through May 31st, and then some of the sample a little bit after, but more so early days. And we do have a second round of quantitative data collection planned for January 2021 that we're currently finalizing our tools for. And then this sample of 643 adolescents actually came from a survey of 780 adolescents through GAGE baseline data collection that was in December 2017, January 2018. And so we basically, for this COVID round, did our best to try to recontact all of those adolescents, and you know, so we were able to do a recontact rate of about 82% of this original baseline. So you'll see I borrow a couple of things for these first slides. I wanted to start just one of the things that I think is interesting and that you get much more nuance from the qualitative data is sort of information like on the knowledge of COVID-19 and prevention. You'll see on the slide here that, you know, when we did our quantitative surveys, you know, 100% of adolescents said they had heard of COVID-19. You know, 99% of adolescents are reporting hearing of hand washing, and 98% say they're implementing it. And so I think part of this is maybe the structure of the questions on the quantitative survey, in which we ask them directly, you know, have you heard of hand washing as a preventive measure? Have you heard of not touching your face as a preventive measure? And so maybe having that prompting got much higher sort of response rates of saying, yes, of course, I've heard this. But there were some areas where we saw maybe some gaps in knowledge or prevention. So among the older adolescents, which this was the only group that we asked this question to, but you know, 70% of older adolescents knew that COVID-19 could be spread without symptoms. And while, you know, 92% of adolescents, you know, have access to soap for hand washing most or all times, and, you know, 98 or 99% heard that, you know, hand washing was important for prevention. When we start to get more into the finer details of, well, how often are you washing your hands? We see that, you know, maybe only 40% of adolescents had washed their hands, you know, at least say 5 times throughout the day yesterday. And so trying to get a little bit deeper at variation in that from the quantitative perspective. In terms of sources of information, I think, you know, I kept these graphics because I think they exactly reflected what we saw in our quant survey. So we ask what the main source of information was only, as opposed to getting a full breadth of sources that each individual had for time constraints. So 80% of adolescents report their main source of information is newspapers or the radio or television. And then the next highest share for sources of information was from friends or family. But this is much more like younger adolescents are more likely to be getting information from friends or family versus older adolescents are more likely to be getting information from social media. And you'll see on a later slide, this largely reflects access to devices with internet access, which I think was also reflected in the qualitative data. And then, we did have some reporting of informational calls or text messages that came through, not from family or friends, but from more formal sources. But again, this is more reflecting this being the main source of information rather than this is, just the percent of people who got information from that area, from that source. So I wanted to talk a little bit about education. I think what we see in the quantitative statistics, again, largely reflects what was discussed on the qual slides. So in our quant sample, about 65% of our adolescents were reported being enrolled in school prior to COVID-19. And so of those who were enrolled, 96% of them report doing something to continue their learning while education facilities are closed. And of course, this, just as a reminder, this is in June of this year. And, of those, we asked what their main way of continuing learning was at that time. And so 80% report that their main way of studying or continuing their studies was using their own books at home. And I did just think it was interesting, the Ministry of Education programming, the Shangshad TV, about half adolescents had heard of it at that time. But only around 8% were using it as the main way to continue learning. And I think part of that has to do with sort of access to television. And so in another location and studying, one thing was found that even if there was a TV in the household, sort of having the adolescent access of privacy and being able to use the TV makes it a little bit more difficult. Then there was still some contact with teachers, which was reflected, I think, in one of the qual quotes. So about 23% of adolescents that were previously enrolled had been in contact with a teacher at that point. And there does, largely adolescents are reporting that their family members are providing learning support in some way, whether it's space for them to be continuing their education or otherwise. But there are some constraints that have entered in where 92% of adolescents report spending more time on chores and 65% are spending less time studying. And especially, I think around 70% of older adolescents that had previously been enrolled are spending less time studying.
Jennifer, maybe a minute or so, if you could finish up.
Sorry, how many more minutes?
A minute or maybe maximum.
Okay.
Maximum.
Okay, so yeah, I'm happy to talk more about a few of these things. I think what I want to skip to is just sort of thinking about economic impacts, and particularly, food insecurity. So, 66% of households lost employment due to COVID, as we know. In our sample, we had 17% of adolescents reported working prior to COVID-19. And 88% reported that their paid work was affected by COVID-19. And at the time of June, 59% had employment stop and had not restarted at the time of the survey. And this is difficult because, adolescents are also reporting at this time, about a third of them giving money to family members who had, so a third of them had money that they control, and of those, about a third were giving money to family members. And so you sort of reflecting the economic insecurity. One of the things that has come out strongly, not just in the Dhaka sample, but also in some research that we've been doing in Cox's Bazar and Sillette, is that food insecurity and hunger seem to have increased as a response to COVID-19. So I want to bring to, 40% of adolescents have said that they're hungry in the last 4 weeks in this COVID survey. And I want to kind of juxtapose that a little bit with, two other statistics is, 24% of these adolescents report that this is happening more often since COVID-19 started. But then also when you look back at our baseline survey in 2017, 2018, which I realize is a couple years ago now, but only 16% of adolescents were reporting this at that time. So there has been sort of an increase in hunger in general. And this is also reflecting, about half of households report cutting back food to male and female adolescents. So I think thinking about the economic impacts and sort of nutrition impacts is important here. So I'll conclude there. I kind of skipped over some things on psychosocial mental health if anybody wants to talk more about that. But yeah, thank you. Now I'll stop
Great.
sharing my screen.
Thank you. Maybe we'll have opportunity. Obviously the slides would be shared, and I think, but in the conversation we can get back to some of the things that you did not cover. Great. I think we've had some really two great perspectives to the original presentation, which I think is now kind of helping us to look at the picture from different perspectives. So at this stage, I think it'd be really great to listen to our Deputy Secretary, Mr. S.M. Latif, especially, and obviously he'll be talking more around the sort of the policy thinking around or reflections after what he has heard. But in particularly, I wanted him to perhaps reflect on the National Adolescent Strategy work that's going on right now, and how this particular research, and we've been doing a number of research around adolescents through GAGE. Just a week back, we presented another one which looked at digital access and adolescence as well, where we also came up with some kind of quite, I think, insightful findings. So would love to hear from you, Mr. Latif, in terms of, what are your takeaways? How are you thinking about what you're hearing in terms of the
Yes, I do hear you. Yeah.
Thank you.
Thank you very much, dear moderator and respected Rashida Chaudhuri, former advisor to the caretaker government, and learned presenters and distinguished participants. Good afternoon to you all. Being a speaker in this auspicious event, I am privileged and honored. Thanks to the organizer for inviting me. As you know, we know the situation and we know the problems, what you have mentioned here. The child marriages and the child labor has been increased to a considerable number, and also the adolescents are facing the violence and the deterioration of community relationship and so on, and so many issues has come. So we have to keep in mind that the situation we are passing through is an unprecedented one, which the world didn't experience in last 100 years. So naturally, this is likely to cause inconvenience to our predicted patterns of work. So our effort is to keep the disruption to a minimum level and continue usual flow of life, adopting the changes as new normal. So, under the Ministry of Women and Children Affairs, in these situations, our adolescents are the most affected on all fronts. Going to prolonged closure of schools and academic institutions, students are compelled to be confined at home, getting little opportunities of meaningful engagement. As a result, they are suffering from stress, anxieties, anger, frustrations. So you know that under the Ministry of Women and Children Affairs, FEC project is working to ensure the safety and well-being of the children amidst the intensifying socioeconomic fallout due to pandemic. During the COVID-19, FEC project addressed the priorities and the needs of adolescents and youth, but they shouldn't only be considered as affected populations, but also as highly effective patterns in the COVID-19 efforts. They meaningfully engaged to be educators and change agents among their peers and in their communities. We have chalked out few programs to cope up with the present situations. As you know that we used to run the adolescent club around the country. We have almost 7,800 adolescent clubs in different areas of the country. And every club consists of 20 female adolescent and 10 male adolescents. And they used to sit twice in a week for 1 hour, and we used to teach them LSB, life skill based education among the club members. And recently we have, as we are unable to run the clubs physically, we have started a few programs virtually to disseminate the COVID-19 messages to them through mobile phones and the posters and the leaflets. The 4,200 adolescents were trained on COVID-19 matches through the mobile phone application called Digital Application for Adolescents. The message focused on prevention from COVID-19 to stay vigilant from gender-based violence, child marriage, and other violence against children-related issues, including mental health, psychosocial support. Adolescents learn to prevent themselves, neighbors, peer educators, their family members, and community people from COVID-19. And this has been mentioned in your presentation also. So we have also an online training program on mental health and psychosocial support organized to build the capacity of CRFs, child rights facilitators who are working in the field level to implement the project activities. They have learned how to deal with the mental health issues and provide the psychosocial support to the adolescents. And as you rightly mentioned, that recently we have started for the first time in Bangladesh to formulate a national adolescent strategy for the adolescents with 5 of the issues: health and well-being, education and learning, protection, transition to work, and participation. As you know, that it is almost in final stage. We have organized so many workshops and talked with the experts, and also took interviews of a different section of the peoples in different areas. As you know, we have another program under the C4D activities. The first one is strengthening families' capacities for developing adolescent girls and protecting their rights. And the other one is facilitating adolescent boys and girls to eliminate harmful social norms and practices, focusing particularly on ending child marriages. And we have we used to organize the coded meeting and interpersonal communication and mobilize the local leaders. And we have we have developed so many TV spots to address the COVID-19 situation and the violence against women and children, and also the child marriages issues. And you'll be happy to know that we have reached almost 68 million people who have viewed our drama, Ichedana, which is telecasting in different television channels. And we have more programs, that comply with the government instructions. FPC project has postponed the regular activities of the adolescent club and introduced an innovative way to connect them through internet and mobile networks. Adolescent clubs activities are now operating through virtually using Zoom meeting and Google Meet and other social medias. Club sessions held twice in a month on life skill-based education issues. We have also running few clubs divided into 2 parts, 1 hour in the morning session for 15 adolescents, and in the afternoon, 15 adolescents in the afternoon, so that they can maintain the social distance and we can run the clubs this way. And the other one is amid the situation, the COVID-19, the CRFs I mentioned to the child rights facilitators who are working in the field level is performing a critical function of the field activities of ABC project in coordination with Department of Women Affairs, UNICEF field offices, and civil society organization for prevention of harmful practices at community level. Practicing positive social norms, ending violence against children, including child marriages, and reporting when violence occurs, and facilitating access to protection service to the government and the non-government agencies. As you know that we have a 24 hours toll-free number 109. We are receiving almost 5 to 6,000 calls every day. This is about the violence against the children, or mostly we are receiving the calls regarding the issues of COVID-19, how to deal with their situations. And this is the way the government is actually working. And as you know, that the school is closed. Now the school is closed. And you also know that the online class is going on in different channels. They can prepare their classes. And also some institutions has already started to take their classes on social media. They are preparing their class contents and give it to their own website, and also using the email, WhatsApp, and other social media. This is the way the students are learning. But how long will do this? And Rashida Chaudhary, Honorable ex-advisor, education advisor to the advisor is here. It's my view that we can, schools may be open. It is my view. I'm telling you, it's not the government. Yeah, we can negotiate, or we can advocate with the government. The schools may be open 6 days a week instead of 5 days, so that half of the students can alternately attend the classes on a 3-day basis, maintaining the social distances. And teachers can play the most pivotal role in running the academic activities in this challenging environment. Mahinapa has mentioned already that I'm not good at math. I want to solve my problem, but I cannot call my teacher. A teacher has to take their responsibility, because this is the situations. We are getting the salary, and government has not curtailed any teacher's salaries. So they have not. This is not only the government who will take the responsibility. The teachers and the parents, and also the society has to come forward and take a sort of responsibility to get rid of the situations. So they can prepare the subject, what I have mentioned earlier, subject, voice contents, and circulate this on the social media, so that the student can access and utilize this with the help of the parents. We have a lots of program. I have mentioned awareness building program is going on around the countries. Other than the government, many non-government organizations are working for improving the conditions of adolescents. Every organization has its own network. We can expedite our work, making good use of this network. Coordination among the government and the non-government is essential, so that the duplication can be avoided and wider coverage is ensured. As you know, there is another forum that is called CPI, Child Protection in Emergency. The Ministry of Women and Children Affairs is leading this forum, and there are 26 others, national and international organizations are members of this forum. We are sitting every month. We are discussing what's going on in the field, and who will do which work, where and when. We are discussing every month, and this is the way the government is working. I hope we'll be able to address the situation if we work together and share our experiences together. Having said that, I would like to conclude here. Thank you very much for giving me the opportunity to speak something in favor of the government. Thank you very much.
Thank you very much, Mr. Latif. I think you laid out the government's actions in this space very in great detail, and I think you just hold attention of this needs a partnership oriented approach is a very welcome one. I'd just like just to highlight a few things from what you basically said, and just for your thinking and consideration. So of course you spoke about the opening up of the school, and you gave your ideas around that. I think that's something we may get back into discussion. Maybe we could ask Rashida Chaudhry maybe towards the end to reflect on the possibilities of that, and what we can do. But I would with respect to the national adolescent strategy, I think the importance of taking the idea of resilience at the center stage is going to be really important. And I think it's really how do we build adolescent strategy which is resilient to different shocks and different types of emergency situations. And I think on this there are obviously risks, and sort of managing risk is going to be important, but also there are opportunities. So engaging adolescents also during the time of crisis can be a great way to take advantage of some of the the entrepreneurial opportunities that this particular age group has. And I think it's also one way of building resilience as well. So I think historically, the youth and the adolescents have been, at the sort of forefront of nation building, and I think that's something, an idea and an energy that we may want to strengthen even further. The other area that I think the two for your consideration and thinking, one is there's a huge amount of data that is being generated, of course, through the different activities and the government MIS systems and the different programs that the government is sort of taking on. These data I think, are national resource, and they can be, really harnessed for us to really be a far more data-driven, country. So even in terms of some of the policies and programs that we undertake, these admin data that the government has access to and is generating as a part of your programs, I think can be hugely valuable if there's a knowledge partnership that is created between the government, who ultimately owns the data, and other research-based and knowledge-based organization. And I think especially national knowledge-based organization. And this is an area that I would really urge for you and to sort of think through. And sort of finally, community radio. I think this is also a very untapped opportunity in terms of many of these activities, even in the future, I think would require a hybrid type of an approach. And of course, digital access is going to be important as a part of that hybrid reality, but so is other forms of technology such as community radio. So I think this is another area that I think can be really sort of thought through. But at this stage, I mean, I think I just wanted to kind of give some of my reflections, and I can see most of the questions have been more or less answered, but maybe we can give 5 to 7 minutes if there is anyone who would like to ask any question, because I can't see anything on the chat box that hasn't been answered. I mean, there's one to Mr. Latif I can see. Is there any plan or initiative for reopening education institution? I think Mr. Latif did, give his views, though it's not a government view. So I think that has been answered. But other than that, I can't see anything on the chat box. But there may be questions that people may want to say, speak up. The floor is open. Great. If there's no more questions, okay, there are no questions on Facebook comment box either. So I think the presenters can congratulate themselves for being extremely clear. And I think also, we've been responding to questions on the chat box. So I think at this stage, it's, I would really like to invite our Honorable chief guest and chair of today's event, Rashida K. Chaudhary, former advisor to the caretaker government and honorary executive director of CAMPE, to give her reflections from what she's heard today. Rashida, over to you.
Thank you so much. Thank you, Dr. Imran Matin. And thanks to, GAGE, BIGD, JPG for this wonderful session. Whenever BIGD or BRAC, any of BRACs, any initiative does something like this, we get enriched and enlightened, particularly by this kind of research at this point of time. Because of the data gaps, because of the information gaps, etc., this kind of data will help us in thinking through and getting to our decision makers, particularly policy makers. So wonderful. The other thing that I would really like to congratulate the organizers or the researchers, most of the time what we do, we don't listen to young voices. We think we are the experts. We know everything. So listening to young voices, that's kind of a, going out of the box. And that's why I would like to congratulate even more all of you listening to young voices and bringing kind of a research output. Every research study has its own limitations. There may be limitations, but whatever we are getting, it's all these things that we have a hunch or assumption. We have been assuming that our young people, our slum area people, everybody has been going through some kind of economic hardship, physical, emotional, cognitive transitions, etc. So these are now being reinforced by all these research findings, all our assumptions or hypothetical assumptions. So this is wonderful. Again, I have been, I am agreeing with all the conclusions that have been made, particularly the issues like source of information, a little bit worry about Facebook, wrong information or may not be timely information, which nowadays the researchers or those who are working with information technology, they are calling it infodemic, information pandemic. That's what is, covering all of us and actually flooding many of the things. So this particular, many of our ideas, concepts, etc., for this particular research will provide sufficient light on this kind of infodemic. No, this is a research-based finding. We need to do something on it. But I would like to take something very positively. Number one positive thing is that we have found people know about corona. Even this so-called lower income or very low income groups in the urban slums of Dhaka city, they know about this pandemic. They also know about how to create safety around them against this particular pandemic. So this is a very positive sign, which we have been observing, but now the research finding is reinforcing this positive finding. And the second positive finding, really, I would like to focus that people are really, really thinking about the situation of education. Bangladesh has been kind of a success story in creating demand for education all over, across all age groups, all economic groups. So this is something being reinforced again, that people want education, particularly adolescents. They have been demanding that or even complaining about that online is not working, television is not working, etc., etc. So their worries are coming out, but through that, there's silver lining in the cloud that people still want to continue their educational pursuit. That's a good one. But how do we handle with all these challenges that are coming out? particularly through this research. One thing I am curious to know from the research team, whether you have studied or you have looked at the cost of all these four modalities that government has been trying to provide or fill up the gaps in learning losses. Chongshot TV, that's TV channel, online, and then radio and mobile network. Television is not accessible to many, but the other three are very costly. We need in uninterrupted electricity, uninterrupted and powerful internet connection, Wi-Fi connection, data and device, both are very, very costly. So have you managed to look at the cost of these things, people, whether they are talking about it, that it's impossible to bear the cost of getting engaged in this type of pursuit in education? So that will help us in getting an idea of the cost of digital learning. We may be talking about hybrid things, but Dr. Imran Matin's suggestion of looking at community radio untapped. We have to talk about it, because any FM radio, if it could be downloaded in mobile phones, feature phones, it could be downloaded. 96% of our population, they have access to feature phones, may not be smartphones, but we have not looked at it properly. We have not used this particular resource using community radios, downloading all these contents, learning contents through community radios, and then listening through our mobile phones. Again, cost will be coming in. So, but some interesting features of this study, like for example, came in. People are much more becoming dependent on, religious things. There is nothing wrong in that. But the issue here is that people are thinking that God's wrath will be there if we don't do it. So it means that our messaging has not been always right. We are not giving proper messages to people. That don't be worried, don't be concerned, don't be afraid. It's just like any other virus, but you have to be careful. Go for your prayers, nothing wrong, but that God's wrath will be coming in. That kind of message that, okay, fine, if we do our bit, then God will be with us. That kind of message should have gone. From the very beginning, we have been observing or watching that sometimes the messages coming from policymakers were not clear. Like, for example, when the schools were closed, the lockdown was in place. The whole family went to Cox's Bazar. And the Cox's Bazar police had to intervene to disperse the crowd. So we didn't give that kind of clear message. Look, this is lockdown, schools are closed, you have to stay at home. So these kind of messages, not only from the government, but maybe also civil society or NGOs also have a role here to provide clear messages to our, particularly to our young and adolescent people who are wonderful in coping and who could be the wonderful messengers for us. So these are the things that we would look into in depth probably, and we hope that BIGD will be looking into all these issues in depth later, because this time it is a corona. During this corona period, we need to be very careful in collecting data, but all the information are there. But all the worries, the concerns that we have been talking about came up in this study also, like for example, increase in dropout, increase in child labor, increase in malnutrition, increase in child early marriage. So all these concerns are reinforced again. So we may have to deal with this through kind of a policy brief, which I will be requesting BIGD to prepare a policy brief on the basis of this. BIGD has already done some of the other studies and research during this whole COVID-19 period, which will be useful to look at and prepare a comprehensive sort of policy brief on the basis of all those research, because we need hard evidence to lobby with our decision makers. And I believe that the issue that is coming in time and again, that students and young people, whether they're in the slum areas or living in urban multi-storied buildings or in many other, well-off places, all the adolescents are worried about their education and to continue, how to continue. So the school reopening will be one of the areas. Maybe we could start on an experimental basis. This is also my opinion. But we need to identify kind of safe zones for the school reopening. In many areas of Bangladesh, the corona infection rate may not be that much, but we don't have the data at the moment, but Health Ministry has the data. So they could advise, the Corona Technical Advisory Committee could advise the government, okay, fine, maybe we'll go for some kind of zoning and go for a school opening, because our students are not feeling good. So we have to create their confidence. And the teachers will be forgetting how to go for instruction inside a classroom. Well, how much they are involved or engaged through all these online courses or whatever. But there is no other alternative than inside the classroom instructions. So we have to maybe think about it. We heard from the education minister the other day that maybe limited scale schools may be reopening. So there may be suggestions from civil society on the basis of hard data and on the basis of health ministry data, where it may be safer to reopen schools, but with all the precautions. And for precautions, we need to invest. Because the primary education ministry has issued a 12-point guideline. Before reopening school, these schools have to ensure these facilities for the students. Even there are guidelines given how to buy these locally, like for example, these masks, like for example, wash facilities, ensuring wash facilities, maybe even thermometers to check temperature. But there are also guidelines given how to procure it locally through tender and procurement committee. Here is one cautionary signal from civil society that from the bitter experience of health ministry, how could we get transparency and accountability in place? So monitoring has to be there. Very clear monitoring. So primary and both the ministries actually prepared a COVID-19 recovery and response plan. So we need to implement it, but with proper preparation, investment, and appropriate strategies. Thank you once again for listening to me. Thank you so much.
Thank you. Thank you very much, Rashida Chaudhary, for your reflections. And I think one area that I think you basically raise, and I really want to highlight this, which is, I think even if obviously the school we need to open in some way, some form or other, and that will happen. However, I think there's going to be a big remedial education need that's going to be really important if we are going to really try and kind of reduce some of the inequities that's going to emerge in terms of the learning loss. Because whatever inequality there has been, it's been deepened even further during this lockdown period. So there has to be a real urgency around remedial education and using whatever available institutional arrangements and technology that we have to really get into a very strong remedial education focus, because otherwise it's going to be, the inequality is just going to be extremely huge, and the social implication of this is going to be big as well. I'm sure we can go on, but I would like to, from myself and then maybe just hand over to Dr. Sabina Rashid, Dean Professor Dean and Professor BRAC James P. Grant School of Public Health to really conclude and give her final reflections in terms of, maybe a future agenda as well. Sabrina, over to you.
Thanks, Imran, for a great moderation, given the timings and everything else. I've got 6 key points that I wanted to share. Really, I thought fantastic presentation, if I can say so myself. I'm part of the team, but I'd like to really thank really great colleagues and a great partnership between the school and BIGD in this longitudinal study. So I really want to touch upon 6 main points. The first point is, and it's been already said, this is a very diverse group, which means that intersectionality is very important. And the lens of structural and social inequalities and inequities are critical to understand the diversity of the adolescent experience, whether it's by age or by rural or by urban or by religion or by disability, by ethnicity. And that really informs their personal, social, economic, mental, and their actual living worlds. And I think that's very important to try and understand some of the risks experienced for these adolescents, as it was so nicely laid out by the Bangladesh team, but also by Wakne from Ethiopia, because there are many similarities. Education is very important, and Rashida Appa talked about this, because education is a dream. It's aspirational, but it's something that's desired by all households. It's like in the 90s, everyone talked about family planning and the small family. What's very interesting is education offers adolescents that hope beyond the usual life of what they see with their parents or their immediate environment. So education promises a better future, a better life, a dream, the possibilities of dreaming more. And it's very interesting because the pandemic has sort of created this cruel optimism, as I would say, because it's kind of taken this back, particularly for those who've had very different experiences, because the reality is, even if they're studying, many poor households invest a lot of money on coaching, on tutorials, books, pens, investing in an education, a lot of hidden and a lot of overt costs in putting their kids through school. And these are for poorer households. So I would say what's really important here is absolutely critical concrete support for adolescents and diverse group of adolescents, from parents that cannot give them support, but just the pandemic just kind of magnifies existing inequalities, but those dreams and aspirations have taken a step back. So I would refer to it as cruel optimism, which is not a new term, but it is really a cruel space that they occupy. The other point I wanted to make was economics. It's very interesting because these are young kids who are kind of in between this world of being adolescents, but not really fully experiencing adolescence. That's been taken away, the lack of interaction with peers, the isolation, the reality of economic, financial burdens, the very real deprivations they see, seeing parents out of work, imagining a very uncertain future. And that has huge implications on an emotional and mental health of these adolescents, particularly because they are taking on adulthood responsibilities at a very young age. And I think it's very important to keep this in mind, because as adults, we're all struggling with the pandemic. But if you're poor, you're vulnerable, you come from diverse backgrounds, social, economic, this has huge impacts. And then particularly if you are disabled, we just finished a national level survey and qualitative on disabled young people and adults, huge implications for that. So I think it's very important to keep this in mind, the weight of the burdens on young adolescents during this period of COVID. My other points are about the whole politics and governance about relief and food and hunger, which Jennifer talked about, because the reality is economic mortalities were as much a concern as was COVID as a fear. And as Wakne said, it's the same now because we've been following adolescents for 9 months. We're doing another longitudinal study at JPG, and they're not so scared of COVID anymore, nor do they wear masks, and they think this is a problem of the rich. The reality is, though, the livelihoods, the constraints, the educational lack of opportunities, and the uncertainty, the life of precarity continues to exist in diverse ways and it varies the degrees of vulnerability. So I think it's very important to see why are peer networks and going to a mosque so important, because it offers a space of being outside of their daily conditions, which are extremely constraining now. Peers offer that space of living something outside of the daily challenges of being an adolescent in very poor socioeconomic backgrounds. The mosques provide a space for networks and solidarity. And I don't think it's just about prayers. I really think it creates a social space where they feel let down by the larger community and society, given the levels of vulnerability and deprivations that are facing many of these households. And final point that was mentioned earlier by some of the other colleagues is I think it's very important to have a very adolescent sort of framework in terms of design, which means from data collection to design to even policy. And I mean, not adolescents homogeneously, but we're talking about 10 to 19-year-olds. It's a very, very different kind of experiences. And if you bring in intersectionality, age, ethnicity, we have studies right now in the ethnic hill tracts where they don't have internet, they've stopped studying, they can't afford it, internet connectivity barely exists. My final point is that if you listen to these lives and the stories, and if I look at some of the research we've been doing, drawing on GAGE, but also parallel studies JPG is doing, adolescents are extremely creative. You know, many have gone back to who've had to drop out of school are street hawking to sell, to earn money. Many are trying to sell fruit. Many are trying to pull rickshaws. They're very creative in terms of, I don't mean to put a romantic spin on it. The reality is they have to survive. They have to be resilient. They're creative, they're entrepreneurs, and they're very adaptive. And if we bear that in mind, they're extremely intelligent, pragmatic, and adaptive to engage with them. And as Rashida Appa referred to it, listening to them, I think we will find very, very easy, effective, pragmatic solutions. So I think when we look at adolescence, my final point is let's kind of unpack what we mean by adolescence and actually try and understand, because if we don't understand comprehensively their experiences, which this GAGE study did, it really leaves us with, you know, bits and pieces. So I think we really need to have a comprehensive approach, and adolescents have to be the leaders in that. So thank you very much. This was sort of my my sort of wrap up for evidence on adolescence. But I do think that a holistic approach in terms of unpacking health and development is critical in terms of understanding long-term structural inequalities and equities. Thank you.
Great. Thank you. Thank you very much, Sabina. I think that's basically, you know, kind of, I think concludes today's event. Didn't really mean to come back and, you know, kind of further.
You gave me a fright, Imran. I was like, it's totally dark because everyone left and I've been talking to myself for a good 15 minutes. I'm very relieved, and I see Mainappa. Thank you for great organizing, and it's very exciting. Oh, I'm sorry. I needed to mention one thing, Imran. Mainappa said this. We are, Rashida Appa, looking forward to doing this joint policy brief with BIGD JPG. It's a joint study. And we will also share our other policy briefs from our nationwide study on male youth. You are so enthusiastic and so committed. Thank you so much. It really makes a difference to the work we do in terms of generating evidence. So thank you. Yeah. I'll shut up now, Imran.
Thank you very much. Sorry we are late by 5 minutes, but I think we did quite well considering everything. Thank you very much.